Last week we talked so much on process variation. We discussed about the different classes of variation. We also talked about the sources of variation, different sources of variation. So today we're going to start on the different methods used in monitoring and managing process variation. Different methods used in monitoring and managing process variation. I told you earlier on that if you listen carefully to whatever I say, I can assure you these are key things that you need to understand. Sometimes you might not find it very easy to get some of these things, even from materials. But the ones I'm giving out directly here are key things that you must take very good note of. I pray you will understand all I'm saying. So, methods used in monitoring and managing process variation. We have different methods. For some organizations, business processes vary by geography, by industry, or due to legal requirements. Okay, so this morning, as part of the various methods that I want to talk about, one of the methods is create high-level standard processes. Create high-level standard processes. That is one of the methods used in monitoring and managing process variation. You have to create high-level standard processes. What do I mean by this? Because even in exams, you might be asked to explain, apart from you identifying those methods, you might be asked to explain those methods or some of the methods, depending on the lecturer. So creating high-level standard processes is often found in newly found companies or organizations. In newly found companies or organizations. Okay, so you create standard processes for yourself in order to monitor process variation. You have to just create a standard process for yourself, and that's why we say create high-level standard processes. And I've told you what I mean by process. Process is a major step in doing things. Process is a major step in doing things. So having this at the back of your mind, you will need to understand what I'm saying properly. Okay. Another method that you can use in monitoring and managing process variation is creating mega processes. What do I mean by mega? Mega means big. Big, large, different types of interpretation. Anything that goes beyond being small is a mega thing. So you have to create mega processes. So this one is encountered during change initiative and technical teams. You encounter this when you want to have a change in your technical teams. You see, you have to create mega processes, preparing yourself for another form of problems to be solved. You see, number 3 method, you have to create individual process. You see, in matured organizations, management often allows this approach because it leads to slowed processes. You see, so we have three major methods through which you monitor and manage process variation. Number one, I said creation of high-level standard process. Number two, I said creating mega processes. Number three, I said creation of individual processes. So we go next to ways by which we can effectively manage process variations. Ways are different from methods. Ways are different from methods. Ways to manage are different from methods used or applied. I want you to get this very, very well. Questions might be asked from any of these two. Ways to manage process variations are quite different from methods applied in managing process variations. Understand those two key things very well. So some of the ways of managing process variations. Number one is you create a global standard process. Can you see? If care is not taken, you will miss this with that of methods. So in this case now, number one point is creating a global standard process. That is, your processing must be global. It must go around. It must affect everybody in the organization. It must not be limited to a particular level alone. It must be global. It must go viral. Okay? So creating global standard process as a foundation for all variations. For all variations. Number two, you have to establish local variations where necessary. Establish local variations where necessary. Number three, you must ensure that all process variations are visible. Ensure that all process variations are visible. Number four, you have to make sure that teams have easy access to the relevant variations. You have to make sure that teams have easy access to the relevant variations. Number five, you have to notify owners of process variation or changes to the standard processes. Okay, you have to notify owners of changes to the standard processes. Okay, then the last point here, not even the last point, second to the last, you have to implement global reporting. Your report must go global. Your report must go viral. That is, it must not be limited to a particular level. So implement global reporting. Then the last year, you have to gather and analyze cost and time data. Gather and analyze cost and time data. If you look at it critically, under the ways to manage process variation, you have more than 6 points. Nobody can ask you for all the 7 or 8 points. You can only be asked. You might either be asked to identify all the points and explain 3 or 4, or identify 5 and explain 3 or 4. Okay? You cannot be asked to identify all and explain all. So let's go straight to chapter 3 now. Chapter 3. We want to talk about value creation. Value creation. Value creation. What do we really understand by the word value? I want you to straight away go to this simple definition I want to give you. This simple and straight definition I want to give you, just note it, because you may be asked to define the term value. Okay? So value has to do with how much something is worth in terms of importance. Value has to do with how much something is worth in terms of importance. So if I go ahead to say explain the term value, you cannot go ahead to say values are standards or ideas with which we evaluate actions, people, things, or situations. Values are also standards or ideals with which we evaluate actions, people, things, or situations. So let me not bother you with any other thing on that value. So we can refer to value as either from a psychological or from an economic perspective. We can refer to value as either from a psychological or from an economic perspective. Okay, that's all about that. Now, I want us to go to advocate for the necessity of the always organizing care based on value creation for the benefits of patients and citizens. Don't bother yourself about the English there. See, just note this: ways of facilitating clinical decision making and patient-centeredness in health care. Ways of facilitating clinical decision making and patient-centeredness in healthcare. I repeat, ways of facilitating clinical decision making and patient-centeredness in healthcare. Okay? Okay. To organize the process of care around the concept of value, a healthcare system based on value as a key component. See, the enhancement of patient-doctor communication. You see, the use of standard device methods. So I want to start mentioning how ways by which you can facilitate decision making. Number one of these is treatment delivery should be based on medical conditions. Treatment delivery should be based on medical conditions. Just know it as that. Treatment delivery should be based on medical conditions. Don't forget the question I raised before this: ways of facilitating clinical decision making. So treatment delivery should be based on medical conditions. Okay. Number two, patient-centered care. In fact, that's number one answer falls under the use of standard device methods. That is, your treatment delivery should be based on medical condition. Number two, patient-centered care. This can be defined as care that is respectful and respective to individual patients' preference. This can be defined as care that is respectful and respective to individual patient preference or patient needs or patient values. Okay, that is number 2. So those are 2 major ways by which you can facilitate clinical decision making. Number 1, I said the use of standard device methods. Explanation has to be treatment delivery should be based on medical conditions. Okay, while the second one is patient-centered care, which can be defined as care that is respectful of and respective to individual patients' needs, preference, or values. Okay, let us quickly, I want to assure you that we are rounding up with this course this morning, with this very one I'm going to treat with you now. This course is rounding up this morning with this very topic I'm going to treat lastly right here now. So all other things we want to start doing will be a revision on this very, very course. So we are rounding up with this last topic I'm giving you. There is something we call P5 medicine approach. P5 medicine approach. P5 medicine approach. So P5 medicine approach has to do with the following. 1, predictive, that is prediction. Predictive, that is it has to be predicted. Okay, number 2 is personalized. 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 Number 3, it has to do with preventive. Preventive. Number 4, it has to do with participation. Number 5, it has to do with psychocognitive medicine. Psychocognitive medicine. Okay, so those are the P5 medicine approach. P5 medicine approach. Predictive, personalized, preventive, participatory, psychocognitive medicine. You will now realize, I want to point your mind to a particular area there. The 5th P, which is psychocognitive medicine, refers to an integration among needs, values, cognitive dispositions, and medical information between psychological and biological aspects. The necessity of a psychological and cognitive profile to an assessment with psychometric tools that includes cognitive decision making, medical aspects, and clinical ones. Okay, so number 5P, which is psychocognitive medicine, has to do to an integration among needs, values, cognitive dispositions, and medical information between psychological and biological aspects. So you may be asked to identify the P5 medicine approach and explain the 5th medicine approach. I may not tell you the 5th medicine approach, but you may be asked to identify the 5th one, which is psychocognitive medicine. Okay, so I'm rounding up now because this is the last topic for this course. So I want us to begin to ask any question that you may be having right now, because from this moment onwards, we want to start revision exercises. Okay, this is the last topic under this course, which is chapter 3 of this topic. So which is process variation. So I want to give room for questions from this moment. Let's ask any question, because from this moment onwards, we want to start a revision on this course, being the last thing we have done today. Okay. It is time for question time now. Time for question. Attend this one. Time for question. I want to receive questions now from the class. Okay, I'm listening to your questions. I want to listen to your questions now. How you pump a level? No, confirm your thing here.
Hello, good morning, sir. Hello, good morning, sir.
Good morning.
Good morning, sir. This is Oblade from the Ikorodu Center, sir.
I can't hear
Hello,
you.
sir. This is Omolade from the
Yes.
Ikorodu Center, sir.
Ikorodu Center, yes, I'm listening to you.
Yes. So thank you very much, sir. We really appreciate for the course, sir.
Okay.
Sir, please, we have a difficult issue on this course, sir. We can't really get
Which
all the points. Okay, sir. We can't really get all the points, sir, but if you can see it on the screen so that we can be able to screenshot it, sir. For more
but the screen is on. You see, I've always been saying, if you listen to my lecture, very well. I am giving you people key points to getting answers. Even if you get the material, you will not find it very easy to get key points.
Okay, sir.
Okay. You reduce the noise there.
Okay, sir.
Reduce the noise there. If you listen very well to my lectures, you will realize that I'm giving you easy key points that you can easily read more than when you are even reading for the material. Okay? Whatever I give you are easy and straight points that will make this easy for you. So what and what did you not understand?
Okay, sir. What I did not really understand there is you said we can record a value as of two ways, which are psychological method and economical perspective. Hello, sir.
Yes.
Under value creation, sir.
Under value creation.
Yes, sir. I don't really understand this, sir.
I explain to you that value, the simpler way for you to understand what value means is that value has to do with how much. Value has to do with how much something is worth in terms of that. Reduce the noise there. Reduce the noise. So value has to do with how much something is worth in terms of importance. And I also say values are standards or ideals with which we evaluate actions, people, things, or situations. And I say that we can also refer to value as either from a psychological or from an economic perspective. All this I'm talking about are all explanation of value. Are you getting it?
Yes, sir.
They are all explanation of values. The areas I really want you to really concentrate much on under value, apart from you understand what value is
Okay, sir.
the ways by which you can manage decision making,
Okay, sir.
which I've been mentioning. Ways by which you can mention decision making. And I
Hello, sir.
mentioned
Can you
two
hear me?
things. You can hear me? Can you
Yes, sir.
hear me?
Yes, I can hear you,
Okay.
sir.
Two ways
I
by
can hear you,
which,
sir.
okay, there are two major ways by which uh, you can facilitate clinical decision making. Number one way is the use of standard device
Yes,
methods.
sir.
The second one is patient-centered care. And I explained the two. I said the number one is the treatment delivery, is that the treatment delivery should be based on medical conditions. Okay? Do you
Okay, sir.
understand?
Yes, sir.
Number two,
Yes,
which
sir.
is
Yes, sir.
patient-centered care, has to do with you have to have respect for individual needs. I think
Okay,
I am
sir.
putting it very easy for you now.
Yes, sir.
You
Yes,
have
sir.
to
Yes,
have
sir.
respect for individual needs
Okay, sir.
or values. Okay?
Yes, sir.
That's the
Yes,
best
sir.
way to explain it.
Okay, okay,
You
sir.
understand?
Yes, sir.
Okay, those are two ways to do that. Then I made mention of P5 medicine approach.
Yes, sir.
P5 medicine approach. Step number one
Yes,
is prediction. Number two is personalized. Number three is preventive. Number four is participatory. Number five is psychocognitive medicine. And I told you in my lecture that you have
okay,
to explain what that number five means. And I said
sir.
it refers to an integration among the needs, the values, the cognitive dispositions, and medical information between psychological and biological aspects. So you
Okay,
may
sir.
be asked to identify the P5 medicine approach and explain the fifth approach. I may not tell you the fifth approach. I may just say identify the five and explain the fifth approach, which means you have to know this in order of arrangements. Do
Okay,
you
sir.
understand it?
Yes, sir.
Okay.
Yes, sir.
So what else do you need to understand? Like I've told us,
Uh, uh,
this is the last lecture. The
okay,
last
sir.
topic under advanced clinical healthcare management. All other things you want to start doing now has to
Okay,
do
sir.
with revision.
I think from the se
All
okay,
right.
sir. Hello, sir.
Yes.
Okay, sir. Please help me out from the second class topic. If I can screenshot it, I think I didn't really get the notes very well. The
Which one is
last
that?
class we had, sir. The last class we
Which
had
one?
before now, sir.
Just pinpoint the exact area you want so that I can explain
Is
it.
I think if please help me to show it on the screen so that I can screenshot it. That you can give me just some
I
following.
may not easily see. Okay, you know what happened?
Okay,
Let me
sir.
quickly say something again
Okay,
from
sir.
that very last topic. Process
Okay, sir.
variation, isn't it? Okay, just
Okay,
note
sir.
it as I'm saying it. You have to be fast because of the time. I
Okay, sir.
started by saying that if we make mention of process is just a major step to doing things. Do
Okay,
you
sir.
understand? Nobody will
Yes,
ask
sir.
you to define the process in exams. You
Okay, sir.
understand what I'm talking about?
Yes.
Okay.
Yes, sir.
Now, I made mention of classes of variation, classification of variation, where we begin to make mention of controlled variation and uncontrolled variation. So we have two types of variation, controlled
Okay,
one
sir.
and uncontrolled one. And I told you that under this control and uncontrolled, we have two processes. We have stable processes and
Okay, sir.
unstable processes. Stable processes is a process that is a process that is stable and it runs in a consistent and predictable manner. And this you can find under control variation. Why the second one, which is unstable process, has no consistency. It has no consistency and it is unpredictable. And you can find that under the uncontrolled variation. So that is all about the classes of variation. I mean, make mention of sources
Okay.
of variation. You must know the difference.
Okay.
There is a difference between sources and classes. So you must not
Okay, sir.
mix the two together.
Okay, sir. Okay, sir.
Okay? You must
Yes,
note
sir.
it very well. I made mention of sources of variation. Number one is lot to lot variation. Number two is stream to stream variation. Number three is time to time variation. While number four is piece to piece. Those are the things we did last week.
Okay, sir.
So if you still need much explanation on this, I can explain them. Lot to lot variation is the
Okay, sir.
differences that occur from one batch of material or processing to the next. That is lot to lot. You will realize that in every drug in Nigeria, a batch number will be attached to every drug. So it
Yes,
has
sir.
to do with the difference that occur from one batch of material processing to the next. Then stream to stream is the difference that occurs from process one process stream to the next. That is from one stream to the next. Then we want to go to time, and that reflects the difference over time. It has to do with timing from time to time. Then piece to piece captures the variation across the products. It captures the variation across the products. That is all we talked about last week.
Okay, sir.
Can you get it now?
Yes, sir. Yes, sir.
Okay. Because I remember today we started by the methods used in
Yes.
monitoring, managing process variation, which I believe you should understand.
Yes, sir. Yes, sir. Yes, sir.
Okay.
Yeah. Thank you, sir. Thank you very much, sir.
All right. Still having 6 minutes, so I'm still giving room for questions. More questions.
Hello, sir.
From
Sorry,
next week,
sir.
we are going into revisional exercises. Yes.
Hello, sir.
Yes, your question.
Uh, Sorry, sir. You see, Omolade, sir. Sorry, sir. Apart from make comparison between
Yes,
quality healthcare and process improvement, sir, did you give us any other assignment, sir? Hello, sir.
I can't get you.
Hello, sir. The first assignment, you said we should make
I
comparison
can't get you.
between quality. Hello, sir. Hello, sir.
Yes.
The first assignment you
Yes, I'm
gave.
listening to you.
Okay, sir. The first assignment you gave from the
Yes.
first class,
Be
you said we
fast
should
because
make
we have
comparison
limited
between
time.
quality healthcare and process improvement. Okay, sir. You said we should make comparison between quality
Yes.
healthcare and process improvement. Okay, sir. I want to know if there is
Yes.
any other assignment, sir. Yes, I want to
You
know
want
if
to
you gave
know?
another assignment, sir, apart from that one. If you gave another assignment apart from that,
I can't
sir.
get you.
Hello, sir.
I've not. I don't think I have. I gave you people any other assignment apart from that assignment, except if I want to
Okay,
give
sir.
you one today. So,
Okay,
but
sir.
I don't
Okay,
have
sir.
intention of giving you any one for today.
Okay, sir.
Okay.
Excuse me,
Uh,
sir.
I want to give you more time to really have time to read, and
Okay,
then
sir.
for revisional exercises.
Okay, sir.
That's why
Thank you
I'm
very
glad
much, sir.
that I ran the lecture today. So
Yeah,
from
thank
next
you
week,
very much,
all
sir.
we are going to do is revision. Okay.
Good morning.
Good morning.
Thank
This
you.
is Amaka from Ikorodu Center.
From Igbe Learning Center. Yes. Go
Ikorodu
ahead.
Center.
Yes. Go ahead. Go ahead.
I'm talking about the assignment. You gave us differentiate between benchmarking and Six Sigma. Shouldn't is that
Okay,
one
that
not
is the
valid
last one.
again?
I
Yes.
ask you to differentiate between what?
benchmarking at
Benchmark
6
and Six Sigma. Yes,
Yes.
yes, yes. I remember now. I remember I gave you that last week. Yes. So what happened about that?
No, I just want to remind you about that. And the question I want to
Yeah.
ask is that please, the 5 phases of process used by component of Six Sigma. Sir, please can you throw more light on that?
I may not really say much on Signal because I'm giving you an assignment on that. But I only want you to understand that under the 5 phase process used by a component of Six Sigma, all these five has to do with number one, define, that is definition. Number two, you have to measure. Number three, you have to analyze. Number three, you have to improve. Number five, you have to control. Okay?
Yes, sir.
So those are the 5 phase processes. So just to remind my sister that just asked a question about whether I gave them our assignment last week, this is a reminder that I
Okay.
ask you to differentiate between Six Sigma and benchmarking. Yes. So for next week, we're going to go into revision exercise. So we're still having 2 minutes for question. We have 2 minutes more for questions. More questions, please. More questions. Questions. We have just 1 minute more. I have 1 minute more. Okay. I'm expecting more questions before my time is up. I'm expecting more questions before my time is up. Okay.
Hello, sir.
More questions.
Hello, sir.
Yeah. Go ahead. Go ahead. My time is up
Hello,
already.
sir.
Go ahead. Go ahead with
Okay,
your
sir.
question.
Sir, there is okay, sir. My question is, you mentioned some factors proposed in measuring. You just you just state the factors. You didn't give us the definition, sir. Factors
Which
proposed in
factors is
measuring the
that?
quality of healthcare.
Which factors? Which
The factors in
factors
measuring after
in
the aims
measuring
of effective and
process
yes, the
improvement?
quality, yeah, under process improvement. Yes, you said the measuring quality of healthcare.
Process factors in measuring process
The
or quality of healthcare.
Quality of healthcare, sir. Quality of healthcare.
Factors in measuring what?
The quality of healthcare, sir.
Quality healthcare. I did explain them
Yes.
now. I mentioned 3 factors. It's
Yes,
structure,
sir.
it's processes,
Process
it's
and outcome.
outcome.
Yes, sir. You didn't give
And
us the
the structure assess the accessibility, availability, and quality of resources. While processes assess delivery of healthcare services by clinicians and providers. While the outcome indicates the final result of healthcare. I explained it.
Okay, sir. Thank you,
That is
sir.
the explanation I'm just giving you now.
Okay, sir.
Structure, process, and outcome.
And outcome, yes, sir.
Structure assess the accessibility, availability, and quality of resources. Process assess the delivery of healthcare services by clinicians and providers. Outcome indicate the final result of healthcare, which can also be influenced by environmental and behavioral factors. Those are the explanations for the three
Okay,
factors.
sir. Okay, sir.
Can you get it now? Because you may be
Yes.
asked to identify those factors and explain
Yes.
all.
Sir, please help me
Okay?
one more time, sir. Yes, sir.
I can't get you.
I say help me one more time, sir, so I can get the full definition, sir.
I said there are 3 factors
Okay, sir.
in measuring the quality of healthcare.
Okay, sir.
I mentioned structure,
Yes, sir.
process, and outcome.
Yes, sir.
And
Yes,
I
sir.
explained structure as a measure that assess availability and quality of resources.
Time up,
Okay,
please.
sir.
Time up,
Structure
please.
assess the accessibility, availability, and quality of resources. Process assess the delivery of healthcare services by clinicians and providers.
Time up,
Outcome
please.
indicate the final result of healthcare. Okay?
Okay, sir. Yes, sir.
So since we are still having much time for revision, throughout next week we
Okay,
are
sir.
going to revise. We are not
Okay,
giving
sir.
any
Okay,
lecture
sir.
next week. So you will
Okay,
be
sir.
free to ask questions anyhow next week.
Okay, sir. Yeah, thank you very
Okay?
much, sir. Yes, sir.
So next